At Charlotte Skin and Laser, we offer ways to reduce areas of unwanted fat, both surgically as well as non-surgically. Non-surgically, we offer a number of different devices, including radiofrequency, laser, and what's known as cryolipolysis or freezing the fat, which is cool sculpting. During your consultation, we'll evaluate the area and come up with the best plan for you, which may even include surgical, which is tumescent liposuction, which is done under local anesthesia, which is surprising to a lot of people and really has minimal downtime. So our consultation focuses on the areas that you're interested in and how to best approach them. It often involves a combination of devices. Our radiofrequency device that we offer is called Vanquish. And Vanquish treats a field area. So you literally lay down on a table and it kind of wraps around you. And we like that for kind of debulking a large midsection. And very helpful. And it actually can prepare you to be a candidate for the laser or cryolipolysis. The laser we use is called Bliss. It's a 1064 laser. And the cryolipolysis is cool sculpting. Cool sculpting, probably everybody's heard about. It kind of grabs the fat and freezes it. But the trick with cool sculpting is the hand pieces. And you have to have areas of fat that can be grabbed by one of the cool sculpting hand pieces and treated. And it also needs to blend in with the surrounding area. And that's why we might suggest Vanquish first, because it kind of treats the whole area, and then we can grab the thickest area of unwanted fat. Bliss can be helpful, particularly if we feel like we just can't get the area you want treated into the cool sculpting handpiece. And Bliss is, again, laser energy, a 1064, applied via these square hand pieces that are placed on the area. So we don't have to have the suction or the pulling up of the fat into the treatment area. We can just lay the hand pieces on the area. And that's why we have these different devices at Charlotte Skin and Laser, because not everything is cookie cutter. Not everything fits into the cool sculpting applicators. Sometimes if you're treating a larger abdomen, to treat that with cool sculpting, it would take a number of applicators and sessions, and the price gets really high. And it just measures out better to do the Bliss laser treatment on that area or the Vanquish. Sometimes if there's a large area and we're concerned about getting you the results you need, we'll actually recommend that you consider tumescent liposuction. And liposuction is done by me in the office, and it's done under local anesthesia. And it truly gives you the quickest, most direct, and sometimes the best results in removal of fat in an unwanted area. This is particularly true in areas that are trickier to treat with our non-invasive devices like outer and inner thigh. Our cool sculpting and body contouring specialist is very experienced in helping outline the treatment plans for you so that you can pick what might be best for you. So if it's outlined that you'll need 3 sessions of cool sculpting, it's often recommended that we evaluate you for the tumescent liposuction. Let's talk about how each device works. All the non-invasive targets fat and destroys fat via that energy. The cryolipolysis freezes it, and this relies on the fact that fat is sensitive to freezing. There's something known as popsicle fat necrosis in children. When they suck on a popsicle, they can get a little swollen area and lose fat in their little fatty cheeks. Well, the same thing is done with cryolipolysis. We also break up that fat with acoustic sound waves immediately after while they're frozen. The laser heats the fat. The 1064 laser penetrates down deep in the skin, and it heats the fat and destroys it through those applicators while the skin is cool. So you have to cool the skin, and the laser energy goes down. And then the Vanquish uses radio frequency energy in a field, and radio frequency comes at the fat from all different areas and penetrates down deep and destroys the fat via heat, just like the laser via heat. Tumescent liposuction, it might sound scary, but it's actually very approachable. It's best to target areas of unwanted fat that are localized. Abdomen, inner thighs, outer thighs are commonly treated. Knees is a great area, and chin. Chin's a great area to do. It is surgery, but it's done in the office under local anesthesia with rapid recovery. The way that we can do that is using what's called tumescent anesthesia, hence the name tumescent liposuction. And tumescent anesthesia refers to very dilute local anesthesia that infiltrates the area, and it tumesces the area, which means it makes it big. So when we make it big, we have a couple advantages. Number one, we protect all the structures underneath. And number two, we constrict the blood vessels so there's very little bleeding. But that's probably the best way to target unwanted fat because we see it come out and we can pinch and measure it. And it's the most direct way and the most efficient way to remove the fat.